Hi, my name is Dr. Kashyap Pirzada. Pleased to present to you some points on long COVID syndrome and some uncertainty that lies ahead for all of us. I'm an emergency physician in Toronto. I work with a group called Mass for Canada, volunteers across the country trying to limit the loss of life from this pandemic. You can find me on Twitter at Cash Prime. Basically, I'm going to briefly go over some of what we know about long COVID. You may not know this, but for SARS-2 and COVID-19 have a number of different phases. The limited upper respiratory syndrome that a lot of you might have gotten in the Omicron wave, that's phase one, and you're very lucky if you didn't go on to the other phases, and that you can thank the vaccines for that. The inflammatory phase is when your lungs and your organs get damaged. The hypercoagulable phase is when blood clots start to develop, people get strokes. The multi-system inflammatory phase children can get, and then the final phase, which is the long-term phase, the post-acute sequelae phase. Um, so if you got none of these things in just the first one, consider yourself lucky. There's unfortunately a lot of people who haven't been as lucky. What is long COVID? It's fairly hard to define. It isn't fully understood, like what's causing it. There's a bunch of theories. There's no agreed definition, which has been part of the problem regarding this issue. The main symptoms seem to be common across many different people. They seem to focus on fatigue, chest pain, shortness of breath, memory problems, concentration problems. Usually they'll last more than 6 weeks after the infection, and generally post-viral syndromes do last about 6 weeks after, and usually stop after 6 weeks. That includes the irritative cough that a lot of people get after viruses. That it is not included in these symptoms. It is definitely real. A lot of previously healthy people are disabled by this. People with no history of any kind of illness or mental illness are getting this, and they seem to have a common set of symptoms. Fortunately, the vaccines reduce but do not entirely eliminate risk. So that's one bright spot, but it's still even in a recent study with double vaccinated people, about 10% still got long-term symptoms. An interesting paper just came out recently trying to identify long COVID sufferers into clusters. One seems to be mostly pain oriented, joint pain, muscle aches, headaches, fatigue. Another one seems to be mostly cardiovascular. We're seeing a lot of these in the emergency department. People coming in with mysterious chest pain, trouble breathing, that we work up and usually don't find anything. Occasionally, we'll find people with heavily damaged lungs that they didn't even know about, which is quite frightening. Um, and then there's a third cluster, which is a combination of the first two, but with fewer symptoms and hopefully a shorter time that they have the symptoms. Um, what are the causes? Immunologists are furiously working on trying to figure this out. Three theories stand out. One is that getting infected with the COVID-19 virus, with SARS-CoV-2, triggers your immune system to start attacking yourself. So you have antibodies that attack, certain critical proteins in your body. The second possibility is that perhaps you have virus staying in your body and activating your immune system and causing inflammation. A third possibility is that your immune system is getting overactivated. So your T cells, your macrophages are getting influenced by the virus and overactivating and causing inflammation. How common is it? As we mentioned before, I think estimates have been up to 30% of people in the pre-vaccine era. With vaccination, that is lower, thank goodness. But one recent paper found that at about 9.5%. That was after two doses. Studies on what happens after the booster dose, they're still pending. It's still too early to say, since most people just got their doses a couple months ago. But hopefully, fingers crossed, it'll improve. But you have to plan for it not improving, because this is all a new area, and by all accounts, if you have long COVID for over a year, it's probably not going to be going away. So it's not something you want to play around with. And increasingly important people are starting to get it, and people are starting to notice that there's just something not right about what's happening. This is Senator Tim Kaine, Hillary Clinton's former running mate, talking about how people don't like to talk about it, It seems that the recent U.S. State of the Union address was a super spreader event. You're having, Supreme Court judges, a large part of the White House off with COVID, and for many of them, it's their second or third infection. So this is becoming more and more common. It's becoming more and more recognized. The key thing is, you do not want to join this cohort. You want to avoid joining them as much as possible until, there's better science or better treatments out there. And again, reasons why you should try to avoid getting long COVID and getting COVID in the first place is that there aren't really good defined tests for it. Arguing for benefits is going to be difficult. This has always been the case in medicine for what we call medically unexplained symptoms. A lot of times, patients are gaslit into believing that it is entirely mental health based, which is wrong. But there's no, there's a precedent for that, especially in the people in the chronic fatigue syndrome, the myalgic encephalitis community. They know this problem very well. And if you look at the cost as a precedent, you look at people with chronic fatigue syndrome or myalgic encephalitis. The disability costs alone are fairly significant. Often completely disabled as well, depending on the spectrum. And again, there's also a predominance. Mostly it seems that 2/3 of cases seem to be in women. So it's something that will hit middle-aged women much more hard than when it hit men. So that there's an angle there as well. And again, the investigations that we have at our disposal are not very good. Many patients with the sort of the cardiac cluster, we can send them for the full range of tests, including echocardiograms, pulmonary function tests. Very often these will be negative unless they have the lung scarring. There's in the long COVID community there tests for exotic tests for microclots or panels for autoantibodies, but these are not a standard part. And I think if you showed up to your family doctor with asking for these tests, they'll just look at you with a confused look, because this is not being studied very well. It's not being talked about. The medical community is not fully up to speed on this syndrome, unfortunately. And again, like, how do we prevent it? I think the best approach is a good defense. Try to avoid getting it in the first place. Avoid getting COVID in the first place, and I think it's entirely possible. This is a nice figure from CIDRAP, University of Minnesota, where they compare the different types of masks. This is why I think removing the mask mandate, especially at the start of our sixth wave, was a terrible idea. It makes a lot of indoor spaces less safe, even when you're wearing an N95 mask. Which in the hospital, it's protecting me from catching COVID after seeing hundreds and hundreds of patients. But that was in a well ventilated hospital. If I go into a poorly ventilated shop or store or workplace, that's not going to protect. It's not an absolute protection. So combine the masking, and effective masking with a good quality tight fitting masking with ventilation upgrades. A very recent study just came out in Italy showing that incidences were reduced in a classroom where they achieved about 6 air changes an hour, up to 82% reduction. So this is an extremely important factor. Aim for low CO2 levels in your workplace or classroom or shop. If it's not low enough, then build these Corsi Rosendahl boxes. These are cheap filters that you can attach to a box fan that can effectively filter the air and hopefully keep you safe. The other thing is, really integrate rapid testing into your daily life and work. This is a sample that we do as a family before we do any gatherings. We text each other, rapid test results to make sure that we're not contagious at that moment. It helps you identify asymptomatic cases and clusters of cases. And remember, even a faint line, very faint line on the test should be considered a positive. There's been some concern about the performance of these tests. I still wouldn't use it as a green light to go to large, indoor gatherings with hundreds of people. I'm still going to avoid those for now. But for small gathering with family, I'll probably still use those. For a small workplace or a team, it's probably useful as well. Maybe it could be used on days when people are having in-person offices. But during upsurges, you should really be trying to minimize that anyways. Really, like I'm really disappointed in the removal of the mask mandates. I'm really surprised that public health authorities went along with this, considering that we're just entering a new surge right now. Really, they should have preserved some of the masking, especially in common areas where immunocompromised, school children, especially young children who can't get vaccinated, have to go, such as in transportation or in schools or in religious gatherings and clinics. So I hope governments will see the light on it, but I'm not optimistic. But it's something that we can still push for. The other thing is it's really uh, I know I just spoke to a historian recently about patterns about this. Is that the politicians and some of the members of the public want this to be like a nice movie with a beginning, middle, and ending. Unfortunately, this virus is not giving us that. This is going to be a continuous problem. Just a few weeks ago we were, in the lull phase, and through the cruelty and vagary of variants, we're unfortunately back in an upswing, and precautions and our need to go back, and our shields need to come up. So that's an education campaign that really needs to get to the public and to workplaces as well. Thank you again for indulging me and taking the time to listen. Please reach out to me if there's any questions, and thank you again. Stay safe, everyone.